This morning's news confirmed what many of us feared. Lindsey Vonn crashed during the Olympic competition and was airlifted from the course. There will be a lot of "I told you so" commentary, but that's not where I land. She completed practice runs and looked strong. If anyone in the world had the strength, neuromuscular control, and mental discipline to attempt this, it would be her. She spent a lifetime training at the absolute edge of performance, with access to world-class rehab and support. This is a great video with diagrams and explainers by MedSpired, by the way. But the core mechanics of ACL injury don't change. When an ACL is already torn, the knee loses one of its primary stabilizers. While I do not know the exact injury sustained in this crash, as I am not her treating physician, these are some of the types of injuries we worry about when the ACL is already torn. Secondary ligament injury to the PCL, MCL, or LCL, meniscus tears, and damage to the articular cartilage that lines the ends of the bones. One injury can quickly become several when instability meets high rotational force. For 99.9% of people, attempting skiing or even casual activity days after an ACL tear would carry a very high risk of compounding the damage. Many patients are unstable enough early after an ACL injury that they can fall just walking around their home. Could this have gone well? We saw that in practice that it might. Could it end like this? Yes, that possibility was always real. Watching that crash was heartbreaking. I was right there with all of you, hand over my mouth, speechless, saying, "Oh no." And I will continue to say this in my clinic over and over. If you tear your ACL, whether you choose non-operative treatment, a bridge-enhanced ACL repair, or ACL reconstruction, return to cutting and pivoting sports is measured in many months, sometimes up to a year. Tissue healing and neuromuscular recovery take time, no matter how strong or how motivated you are. So while elite athletes expand what's possible, they don't change the timeline of healing for the rest of us. I'm wishing Lindsey the very best in her recovery.